and introduce you to Dr. Laura Lockwood. She is one of our child and adolescent psychiatrists. She's wonderful, I think the world of her, and she's going to talk to you tonight about ADHD and medication. There's a lot of controversy in this topic, and she has some PowerPoint slides, and then she's going to address the questions that you folks asked when you signed up. So Dr. Lockwood, if you will unmute yourself and take it away.
All right, awesome. Thank you, Jem, for that nice introduction. I'm going to go ahead and share my screen so everyone can see my presentation. Let's see here. Okay. Hopefully you can all see that now. Like Jem said, my name is Dr. Laura Lockwood. I'm a board certified child and adolescent psychiatrist here at Family Service and Guidance Center. And today we're going to be discussing ADHD myths versus facts. You guys sent in a bunch of questions when you registered for this, so I'm going to be trying to get to all of those. But if you think of more questions while we're talking today, please don't hesitate to just speak up, or you can write them in the chat and I will try to keep track of that there too. All right. So ADHD, there are 3 subtypes of ADHD. There's inattentive type, hyperactive impulsive type, a combined type. You might remember back, like when I was a kid, for instance, there was ADD and ADHD. They changed the diagnosis of this a few years ago to just be all an ADHD bubble. So that's kind of why we're talking about it that way. Symptoms for the diagnosis, the inattentive symptoms include often fails to give close attention to details or makes careless mistakes in their schoolwork, often has difficulty sustaining attention, often does not seem to listen when spoken to directly, often does not follow through on instructions and fails to finish schoolwork, chores, or other activities, struggles to organize tasks and activities, avoids, dislikes, or is reluctant to engage in tasks that require sustained attention, often loses things necessary for tasks, is often distracted, and often forgetful in daily activities. And then the hyperactive impulsive symptoms include often fidgets or squirms in their seat, leaves their seat when they're expected to remain in their seat, often runs around or climbs when that's inappropriate, or in adolescence that might just look like feeling restless, often unable to play quietly, often on the go, acts like they're driven by a motor, talks excessively, blurts out answers before questions are completed, has difficulty waiting their turn, and often interrupts. And these symptoms are required to be present in at least 2 settings. So for instance, both school and home, in order to make that diagnosis of ADHD. There are a few things that can increase the risk of developing ADHD, such as having lead exposure as a young child or even during the pregnancy, the mother using tobacco, alcohol, or illicit drugs during pregnancy, premature birth, and also having a family history of ADHD greatly increases the chances of the child developing ADHD. So here at Family Service and Guidance Center, we require that you come in and meet with a therapist, and after you have a good therapeutic relationship with the therapist, then they can think about referring over to the medication side of things. And that's because we feel like the combination of medications and psychotherapy is the most effective. That's what the medical research shows. Stimulants are probably the medication that you're most familiar with, but non-stimulants sometimes have less side effects. It depends. Stimulants can decrease appetite. Non-stimulants have, of course, their own set of side effects, but generally maybe not quite as marked for most people. A common concern on stimulants is becoming addicted, but I like to point out to people that ADHD actually does often reduce subsequent substance use, although stimulant medications do have an addictive potential. Generally, that's not the case with people who are taking them for a genuine reason. So the first myth that we're going to talk about is that ADHD is not a real disorder. So in fact, ADHD has been around since the 1700s, and there have been over 10,000 studies published about ADHD in that time. like we talked about previously, ADHD is passed on genetically at high rates. So if one parent has ADHD, the child has a 57% chance of developing it. And in identical twins, there's a 75% chance of one twin developing ADHD if the other one already has it. And in fact, we do see a lot of brain changes in kids with ADHD. So that is another way to know that it's not, it is a real disorder. The next myth is that ADHD is overdiagnosed. And in fact, the rate of ADHD diagnosis has increased about 5% a year from 2003 to 2011. But during that time, there was a survey that reevaluated almost 3,000 children who had been diagnosed with ADHD and found that 90% of those children had been diagnosed appropriately. It's likely that the most common reasons for this increasing over that time is just more awareness, more pediatricians screening for ADHD, and also less stigma around kids having ADHD. The next myth is that children with ADHD are over-medicated. In 2015, there was a study that showed that the majority of children who are being treated for ADHD are being treated appropriately or even underdosed. And another study showed that 69% of children diagnosed with ADHD were taking medicine for it. So as you can see, almost a third of kids with ADHD aren't on any medications at all and perhaps could benefit. The next myth we're going to discuss is that poor parenting can cause ADHD. So in fact, twin studies showed that family environment has little contribution to ADHD symptoms. Parents can help kids with their symptoms by helping them to learn organizational skills, by keeping a consistent routine at home. And also having good communication with the school can help everyone to be on the same page and also help the school see what you're using at home that's helpful. Perhaps they can use at the school and vice versa. The next myth is that minority children are overdiagnosed and over-medicated for ADHD. In fact, non-Hispanic white children have highest prevalence of ADHD. As you can see, that's 11.5% compared to 8.9% of non-Hispanic Black children and 6.3% of Hispanic children. This is most likely just that minority children are being underdiagnosed. It's likely that the rate is the same across all of these races. However, there is a higher stigma of having ADHD in minority cultures. The next myth is that girls have lower rates of ADHD and less severe ADHD compared to boys. So in fact, it's likely that girls more commonly have inattentive symptoms versus where boys have the hyperactive impulsive symptoms. So it's really easy to identify when you see a kid who's really hyperactive. But when a kid's inattentive, that's much more difficult to identify, and it's likely that since that subtype of ADHD is more common in girls, that's why it's being missed. And as you can see, by adulthood, ADHD has a 50-50 prevalence between girls and boys. And then another myth is that preschoolers can't have ADHD. So in fact, ADHD cannot be diagnosed until age 6. However, we commonly see preschoolers who have ADHD symptoms and who can benefit from medications, obviously with close monitoring and at low doses. So that's it for my PowerPoint presentation. I put the number on there to schedule an intake in case that's anything you're interested in. And there are some of my colleagues from the medication side of things in our Chiefs gear before the Super Bowl. And they're all doing great work and such a joy to work with. But anyways, with that, I'm going to stop my screen sharing and we'll get to some of those questions. All right. Okay, so the first question we have here is, are there any long-term side effects with consistent use of ADHD medication? That's a great question. We get that one a lot. So as far as we know, ADHD is considered safe long-term. There used to be a lot of concerns about lack of growth in kids who had taken the ADHD medicines long-term. However, new studies have shown that that is not the case. So we do track growth very carefully in our clinic when people come in. but actually it doesn't look like there are any side effects like that. So great question. All right, the next question is, my daughter has been on ADHD medicine for roughly 8 years. Her BMI is about 11 to 13, and I wanted to make sure that's okay. She tends to still have trouble focusing and blurting out in class a lot. She likes to be the class clown, and when she has the class's attention, can't stop. Okay. So that's a really good question. I'm glad that you brought that up, whoever you are. Generally, so we would consider anything under the BMI of 15 to be pretty underweight. So since stimulants, their most common side effect is a decrease in appetite and therefore decreased weight, I would be really cautious in your daughter's case with her BMI around 11 to 13. And I would definitely get with her physician or whoever's prescribing the medication to see if they have any other suggestions. Non-stimulant medicines seem to be, they sometimes can also cause a decrease in appetite, but it's generally much less. So that might be a good option for your daughter. Again, I would talk to their prescriber. Sometimes also we can, if the stimulant's really working well, which I don't know that it sounds like it necessarily is in this case, but sometimes we can also add in an appetite stimulating type of medication or do other things to stimulate appetite, like giving Ensure or Pedialyte or that sort of thing. All right, next question. Is magnesium effective for treating ADHD? So unfortunately, there's honestly not much research into this area. There have been some studies done, but nothing that's conclusively showing that magnesium is a good option. With that said, magnesium isn't something that's going to harm your child unless you're using it in very high doses. And anecdotally, it seems like some people have noticed a difference. As far as some non-prescription medication options, generally I guide people towards fish oil because there is a bit more research evidence for fish oil as a vitamin supplement type of thing to help with ADHD. And again, that does not cause harm unless you're giving it at super high doses. Okay. Oh yeah, that's right. I had taken some notes and reminded myself that magnesium also is shown to help sometimes with insomnia, and sleep does have a very big correlation with ADHD symptoms. When kids aren't getting good sleep, they're likely to be more hyperactive the next day. So that's another reason why magnesium might be helpful. All right, next question. What are some ways to help a child with ADHD and other mental health problems? She says her medications make her feel sick and dizzy and like they're not helping. So I would recommend, like I said before, that your child see a therapist if they're not already. That can be really helpful to learn some organizational skills and some tips to help cope with having ADHD. And also, it sounds like there are some other mental health concerns there. So certainly that could help there too. And if her medicine is making her sick, I would definitely talk to the prescriber about that because it might not be the correct dose or the right medicine for her. It's possible that your daughter might need medicine to help with the other mental health problems too, in addition to ADHD medicine. All right. Is there a link between Vyvanse and hypersexuality? That's a really interesting question. So there is no link shown in the research. I researched this one pretty thoroughly because I had never gotten this question before, but I think it's a really important one. And it looks like there are some case studies there are some case studies about the link between Vyvanse and hypersexuality. However, they involve like 2 and 3 patients each. So I wouldn't call that like conclusive evidence or anything. In general, I would say that Vyvanse is going to actually decrease hypersexuality because it can decrease impulsiveness. And also kids who have ADHD and are not treated with any type of medication tend to have higher rates of unplanned pregnancies too, teen pregnancies. All right, next question. What do you do when ADHD medication side effects are worse than ADHD symptoms? So I think my philosophy with medication management is that you have to really balance and weigh the benefits of the medication with the side effects of the medication. And if the benefits are higher than the side effects, then I would continue the medicine. But if the side effects become more than any benefit you're getting, then that's the time when I would probably stop the medication. So, I think that's when you would want to talk to your provider to see if there's a different medication or a different dose that you can use. But yeah, I generally, if you feel like the side effects are outweighing the benefits of the medicine, then something is probably not right.
Hey, Dr. Lockwood. We had a question in the chat. Somebody was wondering, do you have any guidance that you can provide on what dosing of magnesium or fish oil you might suggest? Because they can mess with gastrointestinal things and bowel movements and things like that. Can you speak to that a little bit?
Sure, yeah, great question. So yeah, you're exactly right. Magnesium and fish oil both can sometimes help with constipation. So if you take too much of it, then you might have some diarrhea. And honestly, as far as the dosing goes, I would have to look it up. I think it's around 500 milligrams for kids for fish oil, but again, I can't swear to that offhand. And same with the magnesium. I apologize. I would have to look that up. I think it's about 300 milligrams for magnesium, but yeah, I couldn't swear to that. I'm sorry. Oh, it looks like we have another question. All right, thanks, Stacy. It says, I'm a child therapist and have a handful of clients that are taking CBD oil in addition to ADHD medication. Is there any potential risks with doing that? Great question, Stacy. Yes, we're seeing more and more of that as well. So I would say honestly that the research is not there to know if there's any clash between the CBD oil and the stimulants, or yeah, the CBD oil and the ADHD medicines. So therefore, I generally try to not encourage that. However, if they're seeing a big benefit from CBD oil, I mean, I think it might be okay, but again, we just really don't have the research. This is all so new with people using CBD oil and stuff that we really don't know yet. So I guess stay tuned as we get more on that topic. Okay. I'm having issues with ADHD medication increasing my 13-year-old daughter's already high anxiety. It's like we have to choose between having ADHD or having uncontrolled anxiety. We've tried non-stimulants, but they don't seem to help with the ADHD. Do you have any other suggestions for kids who struggle with both high anxiety and ADHD? Great question. So there's a very high comorbidity of having anxiety with ADHD. And it's probably going to be helpful if your child is treated with something specifically for anxiety that may actually decrease the ADHD symptoms. So that's what I would suggest. All right, Lee Alexander has some questions. Thanks, Lee. Are you familiar with the concept if you delay treatment, medication therapy, you will decay the opportunity for a positive, productive, optimal life for the individual with ADHD? So yeah, I think that that's a really good point. The sooner you intervene with ADHD or most mental health conditions, to be honest, then it's likely to be less severe. And especially as the kids going through school, they're likely to have better learning and educational experiences if their ADHD is controlled at an earlier age. So that's why we kind of made that point earlier about preschoolers having ADHD. I think the earlier you intervene, the more likely you're going to have positive outcomes. And then we also, Lee mentioned that magnesium comes in 250, 400, and 500 milligrams. I would honestly talk to your child's pediatrician or your psychiatrist about this. I would probably opt for the lowest dose, at least to start with. And then, see if it affects your child's bowels or anything like that before you move up on that dosage. But thank you, Lee, for that. Okay. How can parents best support children with ADHD? So I think we touched on this a little bit before, but it's really important to have close communication with the school. If they feel like an IEP or 504 plan are appropriate, then I think that can be very helpful. The really good thing about those is that they move with the child each year, so that as they get a new teacher, they should already have kind of a cheat sheet, if you will, about what's going to work well in the classroom and what kind of extra supports the child needs. And even if the child doesn't qualify for any of those extra helps, it still is good to be in close contact with the school, because that way you, like I said before, you tell them what works for you, they tell you what works, and you can try to also keep your routine kind of similar on the weekends to how it is on weekdays. And again, as far as the IEP goes, sometimes it can be pretty difficult to get those through the school. What you would want to do is to write a letter to the school requesting an IEP evaluation, and they're legally required to respond to that within, I believe, 14 days. So that's what we usually recommend. At home, you can work with your child on organizational skills, making lists of things to help them, like, here's the morning routine you do. You go to the bathroom, you brush your teeth, you put on your socks and shoes and your clothes, and then you come eat breakfast or whatever it is. So it's step by step, and that can help as well. All right, next question. Are generics as effective as name brand medications? How do you know if it's time to try a different medication or dosage? Can a kid outgrow the needing medication? For instance, what if I think my child needs medicine, but he doesn't think so? All right, great questions here. So I'll try to go in order. So generics are generally as effective as name brand. With that being said, there are a couple that the generic is not as good as the name brand. And it really depends, I would say, on your child's response. But if you are having that kind of concern, we can always request that be name brand only. There was specifically one of the stimulant medications that is not made anymore, but they found that the generic had less of the active ingredient than it was supposed to. So that's why we do keep an eye on that. You're right. Sometimes insurance isn't always super cooperative with doing the name brand, but anyways, how do you know if it's time to try a different medication or dosage? So I guess primarily I would look at how the child is doing. Are they focusing in school? Are they doing their work? Are they super hyperactive at home? Things like that. Obviously, if the kid isn't doing well, then it's time to look at a different dosage or a different medication. Alternatively, I know one of the common things that I hear from parents is that they're worried that their child might turn into a zombie if they take stimulant medication specifically. That is definitely not the intention. If you start your kid on medicines and they do seem to be like a zombie, then it's definitely not the right dose. It might be overdosed for their age and size, or it might just be the wrong medication. I would definitely encourage people to reach out to their providers if they have that kind of concern as well. And then also we look at, like I was alluding to earlier, we're looking at the child's size and growth, and if they're not growing adequately, then oftentimes we might decrease the dose or change to a different medication. And then your last question, can a kid grow out of needing medicine? And what if I think my kid needs medicine, but he doesn't think so? So it is, I would say about 2/3 of kids with ADHD go on to still need medication as adults, but that means that 1/3 of kids don't. And it's often the case that those kids, that 1/3, have self-selected for a job where they don't need to focus as much, or maybe they can be more active, like a construction worker or something like that. I'd say if your kid thinks that they don't need medicine, but you think they do need medicine, one thing that you could try is just, okay, fine, like we'll lower the dose a little bit and see if you notice any difference or not. And that can be a good way for either you to realize that the child actually doesn't need medicine, which would be great. That's, of course, the ideal situation. Or B, the child might realize like, oh, wait, I was doing really well in school with medicine, and now that I'm on this lower dose, things aren't going as good. Maybe I needed that after all. Maybe it was doing more than I realized. So I definitely recommend working with kids on that sort of thing. Let's see, and we have another comment here from Lee. Thanks, Lee. It says, per their pharmacist colleague, taking fish oil directly from the freezer helps avoid the fishy belches from the upper gut as it disintegrates in the lower gut. And keeping fish oil in the freezer does not impact the efficacy of fish oil. Okay, thanks, Lee. Helpful tip.
Dr. Lockwood, can you maybe talk a little bit about, I think we see here at Family Service and Guidance Center, parents that range from the, I will not give my child medication, I don't care what you say, to please, for the love of all that's good and holy, give them something right away. And it's their first appointment. Can you talk a little bit more in depth about how we approach it? I know we approach it a little more holistically than some folks do. Can you talk a little bit about how we deal with medication and when that decision is made that, yeah, maybe you should go talk to one of the docs?
Sure, yeah, great question, Jim. So generally, like I mentioned before, we're going to have you going to see a therapist, and want to see that you're going consistently before anything else is done. And then we do have a range of other services available at Family Service and Guidance Center. So if the therapist feels like those are appropriate, then those will certainly be utilized as well. One thing that we commonly do at Family Service and Guidance Center is we get rating scales from teachers to get more feedback and try to work more together to assess how the child is doing at the school. And that's another way that we can sort of make that decision. I always tell parents that I'm not going to force anybody to take medication if they're very opposed to it or whatever. And sometimes medication appointments can be a good way for the parent to just hear what the options are, get their questions answered, and then kind of think about it too. So anyways, hopefully that answers your question, Jen. All right, so Crystal and Terry had a question. If your child is new to taking medication, what is a good period of time to determine if the medicine is working? Great question. So generally the medication, you should notice some effect from it generally within 1 to 2 weeks. And that's also going to be the time when they're first starting the medicine, when you're most likely to see side effects as well. Sometimes the child gets used to the side effects. Like if at first they have a decreased appetite, that might go away after a week or two. So yeah, I would say after 1 to 2 weeks, you should have a fairly good idea about how it's going to do. Depending on what type of medication it is, it may still continue to have more efficacy with time, especially in the non-stimulants, you see that. But with the stimulants, you should notice something pretty quick. All right, and then we had a question. The patch that you put on or Ritalin-based product, and it can be useful for kids who can't swallow pills. But I've had some very good success with it. Great question. Obviously, every kid. Oh.
Well, I don't know if you cut out for everybody, but I know you cut out on my end. Can you kind of repeat a little bit of that? Because I think it's an important question.
Yeah, absolutely. Sorry about that. So yeah, the Daytona patch, I've had some very good success with it. It's a methylphenidate based or Ritalin based patch that kids who can't swallow pills can use. So yeah, I've had very good success with it. Obviously every kid is different. Not every kid is going to do well with it, but I find it to be a good option in general. And then Lee also said, with CBD products, you have to be cautious about serotonin syndrome. That's a good point, Lee, definitely. And what serotonin syndrome is for everyone, it's something that can happen when you have too many serotonergic drugs, which is drugs like Zoloft, Prozac, Lexapro, and even some non-psychiatric drugs like, for instance, Imitrex for migraines. And when there's too many of those on board, you can get what's called serotonin syndrome. And so I think that highlights a good reason, Lee, why we would definitely want anybody who's using CBD oil or any sort of product like that to let us know. We always want to know any medication or vitamin or herb or anything that your kid is using so that we can make a good clinical decision about what medication to use or not use. Okay, so our next question is, should a child get tested if he doesn't have a diagnosis of ADHD? Specifically, my child is 8 and can't focus in class. Yeah, I would say that it probably would be a good idea to reach out and at least see if there's anything that can be done to help your child. We don't have a specific test for ADHD, like there's not like a blood test or a brain imaging test or anything like that. But when they come in for intake with a therapist here at Family Service and Guidance Center, they are asking about all of those criteria that we just mentioned, as well as a number of other things that can help guide whether that is an appropriate diagnosis and what might be helpful moving forward. What is your go-to first-line medication for ADHD? Okay, great question. Obviously, this is going to be different for every child, depending on family history and medical history and that kind of thing. Also, like I mentioned before, if a child is very small, they might not do as well with a stimulant because it can decrease their appetite. With all that being said, I would say that a methylphenidate or Ritalin-based stimulant is probably my go-to medication because it generally is much better tolerated, and especially younger kids. There are less side effects. So if I had to pick one, that's probably what it would be. And they're generally very effective as well, obviously. So that's another reason why I would choose that. What is the best approach for kids who respond poorly to stimulants, like have aggression and anger? A therapeutic response was not reached with non-stimulants, and other medications have not been well tolerated due to side effects. Okay, great question. So I think, first of all, I would think about, do we have an accurate diagnosis, or is there anything else going on here? Stimulants can sometimes bring out more aggression, so it may just be from the medication. But that being said, if there's anything else going on, then that can also decrease the efficacy of medicines. So yeah, I would say that's my go-to when things aren't going well, you're tried a bunch of different medicines and nothing is working, is to try to reevaluate the problem and see, am I treating the right thing? What is the best way to deal with the school and focus struggles in the classroom? Do you recommend an IEP? That's a great question. I know that with parent conferences recently, this is probably something on everybody's mind. So I think, just like I mentioned before, you want to really stay in close contact with the school to find out how your child is doing and give them any strategies that you found that work at home. I do think that an IEP is a good thing in general, if your kid qualifies for it. It is worthwhile asking the school if they would be able to do some testing, because like I said, the IEP follows them year after year, and even into college. So yeah, and like I mentioned before, write a letter to the school requesting an IEP evaluation, they are legally required to respond to that within 15 days. At what age do you think it's appropriate to start medication if a child has been diagnosed with ADHD? And what does the research say about that? Okay, great question. So like I mentioned earlier, you can't formally diagnose a kid with ADHD until age 6, but we commonly see kids who have ADHD symptoms prior to that. And depending on the child's case, like their medical history, family history, how big they are, things like that. And also if they're engaging in therapy and other services. But medication can definitely be helpful. I would say in kids as young as age 3. Obviously, we're very cautious in kids that young, especially if they're small for their age. However, the American Academy of Child and Adolescent Psychiatry, which is my professional organization, they recommend treating kids as young as age 3. And like we talked about before, I don't remember whose question it was, but the earlier you treat, the better outcome the child is likely to have. So I definitely do recommend that. How do you handle underlying tic disorders brought out by Vyvanse and Adderall? Guanfacine isn't helping. Okay, great question. So tic disorders, what those are, they can be abnormal movements or vocalizations, such as like clearing your throat or things like that. And tics can be more common in kids who are taking a stimulant medication. It is kind of hard to discern because tics are very much more common in general in kids who have ADHD. So sometimes the medication, you may notice it once they start medication, but the natural course of tics is that they generally are going to start around age 6 or so, and then reach their peak by age 11. So they may have been having these tics even without the medication. And what I try to tell parents is that in general, for most kids that I've seen, the tics are bothering the parent way more than they're bothering the child. So I would try to keep that in mind, even though I know that we as parents worry that your kids are going to get bullied or something like that for these tics. The most effective treatment for tics is actually psychotherapy. So, I recommend people whose kids have tics to get that therapy process going if they haven't already. As far as medications to help with tics, you're right that guanfacine is one of the medications that we do use for tics, as well as other alpha-2 agonists like clonidine. Sometimes antipsychotic medication can be used as well for tics. However, we try to be very cautious with that because antipsychotics do have more side effects. They can lead to weight gain and problems with high cholesterol, high blood sugar, things like that in the future. So that's why we really try to be cautious on that. One thing also that I recommend, like I mentioned before, there's a high incidence of kids who have both ADHD, tics, and anxiety. So kids who have anxiety are often going to be more likely to have tics as well. So it might be worthwhile to think about if the kid is having anxiety that's contributing to the tics and seeing if there's more specific anxiety treatment that you might want to pursue. All right, I'm curious if a child must stay on medication for an indefinite period. Okay, good question. No, your child does not have to stay on medication for any indefinite period. I would say the goal is to have your child at a functioning where they don't need medication. And that is definitely achievable. We see that pretty commonly. And I usually tell people, once we start a medication, assuming things are going good and everything, I still want to reevaluate probably around 6 months to see if the kid even needs the medication anymore, if they are able to do well without medication at all. So great question. And like we mentioned before, about a third of kids with ADHD are able to go on to not take medications and be successful in adulthood. Okay. I think we've already covered this question. It says, I would like to know if magnesium could help ADHD symptoms. I've read in medical journals, government websites, and have heard other parents say that it can be a very effective alternative to a regularly prescribed ADHD medication. So yeah, like I said before, I think that magnesium may be helpful. Anecdotally, I've heard that as well, that it can be helpful. However, there really is not the medical research to back that up. And fish oil is probably what I would recommend if you're going to go with a supplement type of medication instead of a prescription medicine. Okay, what is the youngest age you would consider an ADHD diagnosis for a child? And what's the youngest age you would consider prescribing medication? So again, I think we've already gone over this, but just to recap, you can't diagnose ADHD until age 6, but it's common that we see kids who have these symptoms prior. And I would consider even as young as age 3 starting medication, depending on the child's medical history, family history, their size, things like that. And also how severe the symptoms are, how impairing they are for them to learn at preschool. Okay, this is an interesting question. It says, well, Wellbutrin works off-label for ADHD in adults, so can it work in teenagers? So yes, Wellbutrin or bupropion is the generic name. It is used commonly off-label in adults for ADHD. And it does not have FDA approval for ADHD or for use in children for that matter. However, I would say that especially in adolescents who are pretty much adult size, sometimes it can work, especially in kids who are having depression type symptoms in combination with Wellbutrin, or excuse me, in combination with ADHD. Wellbutrin is FDA approved for depression, so that's why we would consider that. All right, and we just got a question from Callie. Okay, just a second. How long does a dose of ADHD medicine typically last in your system? If you're can come off medication, is there a process to follow, or is it just taking them off cold turkey? Great question, Callie. So Callie, I generally recommend, first of all, if your child is at the point where we can think about taking off medicine, that we taper it down slowly, because we want to make sure that symptoms don't increase as we go at the lower dose, and also it's better slowly. It depends on which medication your child is on as far as how long the medicine lasts in their system. For some of the stimulant medicines, it's in and out by the end of the day. So I would say commonly with stimulants, it has about a 10 to 12 hour window that it's working. And after that, it's basically by the next day, it's out of the system, which can be a positive too if your child were to have some sort of side effects or something to the medicine. With some of the non-stimulant medicines, it does take just a little bit longer to get out of the system, especially medicines like Strattera, where atomoxetine is the generic, or a new medication that's on the market in that same class called Quellbri. Those medicines do, I would say, take several days to get out of the system. But good question, Callie, thank you. And then Stacy has a question. Is the cause of ADHD in the brain due to a chemical imbalance or due to mechanics of how the brain works in executive functioning? Great question, Stacy. So ADHD, the frontal lobe tends to develop slower than in other kids. In addition, so I think the answer to your question is both. Because like I said, the frontal lobe is slower to develop in kids with ADHD, but also there is a chemical imbalance. There's a decrease in epinephrine and dopamine generally, or excuse me, norepinephrine and dopamine, which can also affect it. And that's generally what the medications are targeting, is that chemical imbalance right there. All right, so hopefully that was a good answer. Okay, Lee has a question. Is there a higher incidence of depression associated with ADHD? Good question, Lee. I was taught there can be a correlation. Is in general, kids who have ADHD are much more likely to have high anxiety. That said, you're right that some of the ADHD medicines can also be associated with higher anxiety. So it's one of those things you really have to watch. As far as depression and ADHD, there is a correlation between those as well. It's not as strong as what I was talking about before with ADHD and anxiety. But that's why every time some of you guys who come to providers at FSGC probably will notice that even though you're just coming in for ADHD, every single time we're going to ask your kid about their mood and suicidal thoughts and things like that. And that's why we do that, because there is a high incidence of them being present together. But thank you, Lee, for those questions. Okay, I think we're almost done with these questions that you guys submitted. We have, is it true that you can grow out of ADHD? So like I said before, about a third of kids don't need medications as adults and do really well without them. And so I think that for many of those kids, it's not so much that you're growing out of it as that you're doing a job where you can move around and you don't have to be just sitting still all day like you are at school. As adolescents or adults. So there's really no which kids are going to fall into which category. It's kind of question. And then our last,
Lockwood,
yes.
I think you froze up a lot for me during that last question. Can you maybe kind of summarize that one more time? I don't know if anyone else froze, but I certainly did.
Sure, thank you, Jim. Yeah, no problem. So what I was saying was that as we discussed before, about a third of kids do well with ADHD or do well without medicines as adults. And oftentimes this is because they select for jobs where they don't really have to be super focused or don't have to be just sitting still all day like you would at school. But that said, with the frontal lobe being underdeveloped as a component of ADHD, like Stacy had mentioned, as kids grow, there are some kids who catch up and then they don't need medicine anymore once they reach adolescence or adulthood. There's no real way to predict which kid is going to fall into that category. It's more of just kind of a wait and see approach. All right, and then Lee has another question. She says, is it fact or myth? Increased eneresis in males beyond normal developmental milestone age. So I think what you're talking about, Lee, but correct me if I'm wrong, is if it's normal for males with ADHD to have eneresis beyond a normal age. And I would say there's not really a correlation between ADHD and eneresis. Okay, yeah, that is what you're talking about. Okay, thanks, Lee. One thing that I have seen, which I think might be part of where this comes from, is that sometimes kids, and I would say more commonly boys, are too caught up in like their video game or TV or whatever to go to the bathroom, and then so eneresis means wetting yourself. So they might have that, wetting themselves. The most common reason for wetting after age 7 is that it just runs in the family. And this is more common in males. But that said, I generally recommend when I see a patient who's having that happen that they talk to their pediatrician to see if they need any further workup. Probably the second most common reason for that is having bad constipation can lead to wetting. Great question, Lee. All right, and this is our final question of the pre-submitted ones. what are the long-term effects of medication? So that ties in nicely. I think that was roughly our first question too. But again, there aren't any proven long-term effects. We used to really worry about decreased growth, but as we've had more research, we found that that is not the case. But anyways, so I think we're done with all those pre-submitted questions. Does anybody have any more questions that you want to ask?
We still have a few more minutes, folks. So if you have questions, please feel free to ask them. There was one question, Doctor, and I'm sorry, I wasn't sure if you saw it or not.
Oh, okay.
I got distracted by something shiny, I'm sure. But there was a question about, and I can't remember who asked it. I think it was our person who is a child therapist, had asked a question: is ADHD a product of the wiring of the brain, the architecture of the brain being different, or is the cause of ADHD in the brain due to a chemical imbalance or due to mechanics of how the brain works? In other words, executive functions. I think that's a really good question.
Yeah, I agree. That's a great question. And then, you know, that might have been around when the internet kind of froze up for a second. So yeah, it's worth revisiting. I agree. So it's really both, I would say. The frontal lobe tends to be underdeveloped in kids who have ADHD. But additionally, norepinephrine and dopamine are also decreased in kids with ADHD, which is what the medications are targeting. So yeah, I would say both things. Great questions.
You have another question. Factor myth: increased incidence of picky eating habits in young males with ADHD.
That's a great question, Lee. I think that that's also a myth. There, of course, are kids with ADHD who are picky eaters, but I don't think it's specific to ADHD or ADHD. Very good question, though.
Okay. You have one more that somebody'd like to ask? Feel free. Well, if it's okay with folks, then I think let's call it a night. Thank you so much, everyone, for joining us. Dr. Lockwood, that was terrific. So much information, and I think a lot of the questions were very specific, but yet I think they're things that all of us who have kids with ADHD think about and wonder about: is this my kid? Is this not my kid? I would encourage anybody who, if something Dr. Lockwood said this evening struck a chord about a child or a grandchild, foster child, whoever it may be, feel free to call us. We're at 785-232-5005. You can get an appointment, get an intake done, and we can get your child down the road to finding out maybe if medication is appropriate, maybe if there's something else going on. Dr. Lockwood, anything you'd like to close with?
No, I appreciate everyone spending their evening doing this. And just to reiterate what you said, Jem, if you do feel like you want to call for an intake, but yeah, I all the questions, everyone. These are really good questions.
Really good questions, folks. All right, well, I'm going to stop recording, and thank you so much again for being here. I don't remember the topic of next month's real world parenting conversation, but it will be coming up on the third Thursday. Keep an eye on our Facebook page, and we'll let you know probably in the next few days. So on behalf of Dr. Lockwood and I, thank you so much for joining us, and have a great afternoon. Have a great evening.